Hello, my name is Dr. Dewan S. Raja. Today I will discuss about Fanconi Syndrome. What is Fanconi Syndrome? Fanconi Syndrome is an uncommon disorder which damages the kidney's proximal renal tubule, which can limit the body's ability to reabsorb glucose, all amino acids, phosphates, and occasionally calcium and sodium bicarbonate. We know that kidney is composed of nephron. Nephron has different parts like that of glomerulus, proximal convoluted tubule, then the descending limb of loop of Henle, ascending limb of loop of Henle, collecting distal convoluted tubule collecting duct. In Fanconi syndrome, the proximal convoluted tubule epithelial cells and also the entire structure of the proximal renal tubule is damaged or become non-functional. Normally, the kidney filters these chemicals before reabsorbing them into the bloodstream, but in Fanconi syndrome, there is an abnormality in this reabsorption mechanism, which leads to an excessive loss of these compounds in the urine. Nephrogenic diabetes insipidus and metabolic acidosis may be linked to Fanconi syndrome. Fanconi syndrome's main symptoms include excretion of glucose in the urine in spite of normal blood glucose level, known as glycosuria, increased excretion of amino acid in the urine. Virtually all the amino acids are excreted, known as amino aciduria, increased phosphate loss in the urine, known as phosphaturia, renal tubular acidosis. Metabolic acidosis results from kidneys' incapacity to appropriately acidify urine. Electrolyte imbalance, the body's electrolyte balance is upset when electrolyte like potassium and bicarbonates are lost in the urine. Types of Fanconi's anemia. One type is inherited, genetic, another is acquired form of Fanconi syndrome. You have to remember that Fanconi syndrome is different from Fanconi anemia, that is a completely different entity, a problem of the bone marrow. But Fanconi syndrome is mostly a problem of the proximal convoluted tubule of the nephrons of the kidney. So you got that two type, genetic mutation affecting the renal tubule. Functions are frequently linked to inherited form. Acquired forms can result from exposure to specific chemicals, pharmaceuticals such as antiretroviral medication used in the management of HIV infection, and obsolete tetracycline or old tetracycline antibiotics, or as a side effect of variety of illness like multiple myeloma. There is a tumor of the plasma cells, and ischemia-induced necrosis. Ischemia means lack of blood flow, necrosis of the proximal tubular epithelium. So these are the possible causes of acquired form of Fanconi syndrome. It may be genetic due to mutation. Okay. Symptoms of Fanconi syndrome include weakness, bone discomfort, rickets, stunted growth in children. The underlying region determines the course of the treatment. If a medicine is the cause, like that of tetracycline or antiretroviral drug. Stopping the medication might help the situation. Supportive action like replenishing electrolytes and controlling metabolic acidosis should be required in specific situations. So, Fanconi syndrome is a complex disease, and each patient's underlying etiology and symptoms should be taken into consideration when managing the condition. Seeking advice from a nephrologist is essential if Fanconi syndrome is diagnosed because of concerns about the kidney function as well as the entire body function. And that's all about the Fanconi syndrome. If you have any question, please feel free to ask me. And please remember that Fanconi syndrome is quite different from Fanconi anemia. I have another YouTube video on Fanconi anemia. If you have any chance, please go through that. Again, please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.